Hi, I'm Claire Carter, as I've just been introduced. Many thanks for joining us today. Really, it was just to bring about David's short clips on YouTube already. And I just wanted to ask each of the panel members to introduce themselves. So David, could I come over to you first, please?
Yep, my name's David Foreman. I'm a Senior Lecturer in Nursing at the University of Derby.
Teresa?
Hello, I'm Teresa Critchlow. I'm the Programme Leader for the BSc Children's at University of Derby.
Thanks, Teresa. Steve?
Hi, my name's Steve Coach. I'm the Programme Leader for the MSc Nursing Adult Programme at University of Derby.
And finally, Debbie, as our final panel member.
Hello, my name is Debbie Watkinson. I am the Assistant Programme Leader on the BSc Adult Programme, Adult Nursing Programme, and I'm based in Chesterfield.
Brilliant. Thank you so much, all of you. That's really good of you. So really what I would like to do is to reach out to each and every one of you on the panel today and to kind of sum up what your role involves now and what your specialism has been in no more than just maybe a couple of minutes each, to just give you an idea and flavour of what you currently do and what your specialism is, please.
You're coming to me first. That's all right. I've been qualified for 22 years. I started off by going to the University of Manchester, but before that I was a healthcare assistant at Nottingham City Hospital. Once I qualified from Manchester, I came back to Nottingham, worked in Nottingham at Queen's Medical Centre in surgical services for 5 years as a staff nurse, before moving into specialist clinical practice and clinical education at Derby hospitals. Worked there for 8, 9, 10 years in colorectal surgery before moving to the University of Derby as a senior lecturer.
Thanks. Thanks very much, David. Teresa?
Thank you. Well, my background is children's nursing. I qualified and went to work in accident and emergency down in Cambridge, and then back up to Nottingham ED. And then I went into safeguarding for quite a while, and I worked in the pre-hospital care element. So I worked the ambulance service in safeguarding. I became a lecturer for paramedicine and the technician courses. And then I joined the University of Derby near enough 2 years ago, coming up. But my main background is clinically working within children's services.
Thanks, Teresa. Over to you, Steve.
Hi, as I said, my name's Steve Coach. I've been qualified, good heavens, 29 years now. I qualified in London. My first ward was a mixed general medical and dermatology ward, and then I specialised in general medicine, and then did that for a bit, and then transferred hospitals and started to specialise seriously in respiratory medicine, and I basically did that for the whole of my clinical career. So I worked in respiratory nursing in London, Leeds and Birmingham. Did that for 9 years, and then got a job in University of Leeds as a lecturer practitioner, and eventually got a full-time job at Birmingham City University as a senior lecturer in adult nursing. And I specialised in teaching respiratory nursing, adult general nursing and evidence-based healthcare. Did that for 15 years and came to Derby 5 years ago to run the MSc Nursing Adult Programme, which we've started up from scratch. So that's what I've been doing for the last 5 years.
Thanks so much, Steve. And finally, Debbie.
So I'm dual qualified, so I'm an adult nurse qualified and also a midwife qualified. I started my nursing journey back in the 1980s. So I started in 1980 doing my general nurse, and then in 85 I did my midwifery. I'm also a specialist sexual health nurse, which I've only recently given up practicing, which is something that I really enjoy. I've been at the university since 2007, first of all working in an FE college, working with health and social care students, and then I joined the adult nursing team 7.5 years ago. I'm pretty much responsible for stage 3 at the moment. So I look after the adult nurses in the final year of their programme, guiding them towards qualification. And also as assistant programme lead, I work with the programme team to ensure that the programme runs smoothly and that students are well supported.
Thanks, Debbie. So we've got a real variety there between the four of you. So I hope that the answers that are coming up are really going to be as interesting and variety in relation to those specialisms. So what I'm going to do now really is to reach out to David to, if you could, explore as to why you felt that you need to undertake many of the videos that you've done with the University of Derby lecturers. What was the initial idea? Why do you think it was important to talk to them? And what did you learn from them, or what do you hope others would learn from them through those videos? So over to you, David.
Okay, there's lots of questions there, Claire. To start with, I suppose the main motivation was the fact that we started our March 20 cohort started on the 8th of May, something like that. And within a fortnight, they'd been sent home to work from home, and they didn't know us. And a lot of our program, I think, depends on the students getting to know us and us working together. And I thought actually it'd be really nice to find a way of sort of engaging with them, so they find a bit about us as people rather than just someone who's delivering lectures. So I did one or two, and I thought I'd brush up on my YouTube and editing skills, just as sort of I suppose when you're stuck in the house for 23 hours a day, you sort of need to find yourself a new hobby, and mine was editing videos. And after the first one or two that I'd done, I found that actually I was getting a lot from it as well. I was chatting to colleagues that I'd worked with for years and years, but not actually chatted to them about their background, about what they'd done in the past. So I learned a lot from my colleagues as well. And so that's really the main motivation for doing it. And then we were thinking about future cohorts, about the next cohort that starts in September, because they weren't even going to get the 2 weeks with us potentially. So it's whether we could use it for introducing the team. And then other members of the team were thinking about it in terms of career development, and like we're doing here, talking about our careers and the things that are useful and important when it comes to having a career in nursing. But as you've said, we all come from very different background. So what Teresa and Debbie and Steve have done are entirely different to what I've done for my entire career. Yet we're all nurses on the same part of the register, pretty much.
Great, thanks, David. So just as an addition to that then, what kind of feedback have you had because I mean, I find them really insightful, and like you say, probably your staff do. What are the students saying, and have you heard anything from the wider public since they're on YouTube?
No, we haven't done any sort of official audit or any sort of information gathering exercise about who's using them. We have used them slightly more formally in our induction, in as much as we've given them the links, and I can see by the numbers of people that are watching them that our students are engaging with them on particular days at particular times. There's a few comments in the comments section on YouTube, but not very many. But I wouldn't expect it, really, because our students don't get to know us. They don't know, they see us on YouTube, and they don't feel they have that ability necessarily to engage with us quite as they would if we were on campus. Those students that have left comments and those students that have spoken to us in person have all said they've enjoyed it. I think it's because they get to see the sort of more personal side of us as well as our sort of professional side.
Yeah, absolutely, and that's great that you're linking that to their starting and induction. So fabulous, that's great, thank you very much. So really, just to open up to all of the panel for the next question is, can you tell us about some of the things you've done in your career and what have led you to where you are today? So happy in any order, if anybody wants to shout up. I'm going to go with Steve.
Me first, okay. What have I done in my career? Well, I've always been very interested in chronic illness. There are lots and lots and lots of conditions that can't be cured. And I specialised in respiratory conditions, but actually it was very wide ranging. And I just got gripped really with the sort of relentless violence of these conditions and what they could do to people. And so my career was basically dealing with people who weren't going to get better, but they could stabilise and then deteriorate, stabilise and deteriorate. And it was about maximising their ability to live in the face of sort of a relentless condition that wasn't going to stop. And I found that fascinating because you have to build people up, and also because it's a long-term thing, you got to know them very well. And so you kept on seeing the same people and kept on seeing the same people. And that was in every hospital that I worked in. So I got grit really by being able to maximize people's capability in really difficult circumstances, and because the impact of those long-term conditions were holistic, it had massive effects on their lives. My entire job was always holistic. You had to consider family life, you had to consider their emotional state, their ability to work, the responsibilities they had as adults to other people in their family. And I just loved it. I really enjoyed it. And it was something that I was good at. I basically spent my training working out what I wasn't going to do. I mean, which wasn't a bad way of doing it. You know, I was admitting to myself what I wasn't good at. And I kind of found my niche as I went along. So I decided very early I wasn't going to be a surgical nurse, you know, and a mental health nurse wasn't going to do that. Children's nursing wasn't going to do that, because I was a registered general nurse. I was an adult. So the way that I approached what I was going to do was to work out what I wasn't going to do. And by the end of 3 years, a chronic respiratory general medical nursing was what was left. That's kind of what I went with. And, you know, that's what I teach. And to some degree, that's what I still do. And it stood me in good stead. And I've never regretted doing that. So that's what I did. And that's kind of the motivation for why I did it. It was, I got gripped by trying to dam the effects of relentless illness and the effects that relentless illness can have on people, and trying to do something about it to make sure that they could maximize their capability and live. And doing that for people, I always found immensely rewarding. It was a good thing to do.
Brilliant, thanks, Stephen. I think there are some of the themes that will come up over the kind of skills required, perhaps across all of the sections, but maybe let's go to Teresa then, if that's okay, to explore, just as a recap, tell us a bit about some of the things that you've done in your career and how they've led you to where you are today.
Of course. So my career is, I very early on became a specialist nurse in safeguarding. And for me, that was the opportunity to ensure that the child's voice is heard and that we think family. So we see the child, but we see the wider family and how we can influence their choices and decisions to get them their best opportunity. And I really enjoyed seeing these families grow from small interventions and support. And with that meant that supporting our student nurses that were coming through the specialist services as their student experience, they took loads from that, looking at how we can make suggestions and interventions to help. So I kind of got my passion for a bit of both, really, helping students see the wider picture and seeing that some decisions are not the best decisions and how can we influence that, but also helping the families with those students, because from a longevity perspective, investing in our students to support these families mean that the future generation of children that will grow to be adults have better options and choices. So I went into lecturing after that, and I worked with pre-hospital services across 4 or 5 different universities, and that's where my real passion for working with students came from, to help them grow as well and them have those same values that I have, but on a wider scale, on a larger demographic area. So that was my direction, really.
Thank you so much. So Debbie, if I can come to you next, are you okay with the question?
Yeah, that's fine. So obviously I've worked for a very long time as a midwife out in community practice, and similarly my sort of motivations out there were a little bit like Steve's. I wasn't working with patients with long-term chronic illnesses, but I was working with people who I got very close to and I got to know very, very, very well. And you know, it is like working with the whole family and supporting women through the pregnancy. And I think moving forward, I've carried that on within within my adult nursing career and then within my teaching career. It is wonderful to be able to invest yourselves in students and see students progress through their training, through the programme, and then, you know, gain all that knowledge, gain all that experience, and be able to support students to actually get through and qualify. I've been very lucky to be involved in the midwifery curriculum that's been developed as well as sort of working within the adult nursing programme. And I think very exciting times are ahead for us at the university. So I think, you know, in terms of my career, it might have been very different from other people's, but there's still the importance of developing those long-term holistic therapeutic relationships that will enable you to sort of support your families, similarly support your students through their journeys.
Thanks so much, Debbie. And finally, David, over to you.
I'll keep it short. When I was making a decision to move from surgical services at Nottingham, I think I was ready to move into a specialist type role. And in my head, I thought as a nurse, you can move into education, management, research, advanced practice, or stay where you are. And I managed to find a job which was education, advanced practice, a bit of research, a bit of management. So it's sort of the best of everything, really. And from there, it was the teaching that was the main part of the job that I really enjoyed. So that's why I've ended up sort of moving my career towards education, rather than sort of staying with advanced practice or sort of research and management was never my thing particularly. But that's what I felt at the time were my sort of 4 options for progression.
So David, just to pick on that again, just if I may, that when you talk about the teaching element finally there, do you think that was quite early on in your career? As in, did you support students? How did that come about? Was that something that progressed slowly over the time?
Yeah, so I've always supported students, even when I was a student. You know, we as student nurses, we often had junior students working with us, and we were expected to sort of impart our knowledge and help them along and guide them as best we could. As soon as I became a registered nurse, I did a course called the EMB 998, which I would imagine everyone's smiling at now, which is the old-fashioned teaching and assessing course, which was a national course. And it's the teaching and assessing course that old nurses did, but again, that gave you a bit of theory, a bit of background into how teaching works, how assessing works, and what it's like supporting students in practice. And really enjoyed having student nurses working with me as a staff nurse, and it sort of developed into that. Really, it's something that I felt I was good at, something that sort of at the end of your shift you felt like you've achieved something in terms other than just sort of your clinical goals. You'd also sort of managed to help a student along as well, so it's sort of developed from there, really.
I think then bringing all of those answers together, there's some kind of commonalities between them in terms of that supportive nature, whether that's with your patients, their families, colleagues, students, albeit in different subject areas. Do you feel that they're kind of key themes maybe that you all share? And further to you maybe, David, and the others can answer it in after this. Did you see that across the many videos that you created of the staff?
Well, you've got me thinking now.
You don't need to answer if you don't need to.
I'm trying to think of key themes. I think obviously the time in which I was filming them was last summer, when everyone was all sort of locked down and sort of had a bit of cabin fever. And the things I think that I took from it was that nursing, there's no real career pathway. There's no real specific career pathway like there is in medicine, for example. We forge our own particular paths. You know, if you want to stay nursing your patients on the wards or in district nursing clinics or wherever it is for your entire career, that's absolutely doable. If you want to become a specialist nurse, if you want to become a manager, if you want to become a nurse consultant, if you want to become chief executive of hospital, all of those things are within your capability, but it's up to you to carve out your own pathway. And listening to everyone's stories, everyone's done that in a really different way.
Thanks, and I think that kind of leads us into the next question that I was intending to ask you, but I just want to reach out to the rest of the panel in terms of, do you think that there are common themes that you kind of all mentioned in terms of linking back to being holistic, those relationships, linking with patients, their families, for example, listening and listening to voices? Are they kind of common themes that you would expect now as much as they did, which is what you got your interest in, your specialism back then? So over to Steve.
Yeah, I mean, I think so. I mean, you've just got to fit, basically, and it's very difficult to know where you fit until you experience it, and you can't really predict what it's going to be, because even within general medicine, I went to some wards and I wouldn't have worked in that area. Like, for example, a liver function ward, for example, it wasn't. I enjoyed it, but it wasn't me. So even within the speciality of general medicine, medical nursing, where I fitted for me personally was quite specific, and that's where I felt at home, and you know, and one flatters oneself that one was good at it, and you felt comfortable, and you know, it's like other nurses would go, well, you're a respiratory nurse, so you're having to do this, that, and the other, and we only do hearts, and we like hearts, and you like lungs, and well, yeah, that's fine, absolutely. So everybody, although the two systems connect and they're very important, and they can't run without each other, and there was always cross communication between two clinical areas, the philosophies were very different. And the other thing as well is the speciality tends to generate a philosophy of care. And so the other thing to think about is where you're choosing to work, does the philosophy of the unit fit? And that's what students have to get their heads around, is that they're seeing different philosophies all the time in quite similar areas. So I was quite careful about not only the speciality, but did the general philosophy about what we're trying to achieve here for people, how to look after people, how to care for people, what people were going to be able to do and not do. What problems did we think were important in terms of human care? I was very careful about the philosophy of where I worked, and that fitted what I thought nursing was. So for me, it's a mixture of speciality, fit, and philosophy. And the test is, do you want to get up in the morning and go to work? And if the answer is yes, you're probably in the right place.
Thanks, Steve. Teresa and Debbie, is there anything to add to those two? No pressure if not.
I think for me, if you look at my colleagues and I think what we all share is that we enjoy people. We enjoy being around people. We enjoy making a difference. We're really friendly, and we enjoy that diversity of the people we meet. And I think for me, when I look at our teaching team, we all have that common foundation of that, really, that our values and our morals align quite alike to each other, and that we want to help others to achieve. And so I think that is a key theme, and I think that is a key theme for nurses. And I know when I do my interviews, a lot of the potential candidates often allude to those kind of key foundations and qualities, but it really is important, and it's something I do recognise in my peers.
That's great. Thank you so much. And I think we've kind of alluded to some of this, but it's really to explore in a little bit more detail is, you know, I guess, did you ever think that you would be coming into lecturing those years ago when you were looking to do nursing career? So what unexpected places might a career in nursing take you? And it's kind of a flavour that kind of is important to me, because there's quite a lot of journeys. You know, there's 4 of you, very different journeys. If you look at the further videos that David's undertaken with the rest of your colleagues, very different journeys. So tell me a little bit about those unexpected places and where nursing might take you. So what are the options out there for people right now listening today? Where could their career in nursing take them? So if I go to, stay with yourself, Teresa, you're on the screen. So is that okay?
Of course. So I think from a children's perspective, children's nursing is something that is quite specialist. However, it's not restrictive. So as a children's nurse, you have the opportunity to work in mixed areas, so neonatal unit. We have A&E outpatients. I, as a children's nurse, became a specialist safeguarding nurse, and then went to teach on a field of expertise that isn't aligned not massively to children's nursing. But I taught on midwifery and paediatrics for paramedicine, and I supported students, so I was placement support lead for a pre-hospital environment. So from my perspective as a children's nurse, because often people say, well, how do you know you wanted to be a children's nurse? I definitely always wanted to do children's nursing. I'm very much about advocating for the voice of the child and how we support them to get their needs met, and then the families. But it doesn't restrict you. Whereas you can have your speciality be adult and mental health, but now the options for that has also broadened in the fact that you can qualify in one field and then do your master's top up to be dual qualified. So just like Debbie's done, so she's adult and midwifery. We offer the same programs for expansion. When you have your first degree, you can do a second degree in a different speciality, which I think is phenomenal and a great opportunity that you can have that dual registration.
Thanks, Teresa. If I could go to Debbie, if that's okay, next.
Yeah, that's fine. I completely agree with Teresa. I think it is a really brilliant opportunity that people can become dual qualified. I've been really lucky to be able to keep my dual qualification on throughout the duration of my career. So while I was a midwife, obviously we did some adult nursing procedures, so looked after surgical patients, for example, after they'd had cesarean sections. So you were able to keep on your adult nursing speciality. And when I've since come into education, again, I've managed to keep up my dual qualification by working as a sexual health nurse, and by working with some parts of the specialised programme, teaching parts of the maternity programme, for example, raising awareness of maternal mental ill health. So I think it's a really good opportunity for to be able to sort of keep your options open, I think, a little bit when you're embarking on a nursing or midwifery career, because it is a huge career with lots and lots of different opportunities. I've done lots and lots of different things. So, for example, I worked for 2 years as a specialist teenage pregnancy midwife, setting up services across the county for young people and their families who were having babies. It was recognised that there was lots of issues around teenage pregnancy and teenage parenthood. So I was really lucky to be able to support young mums and young dads across the county with their new babies, working a little bit similar to Teresa's role within safeguarding. So enabling these young people to, set out on their parenting journey. And I think that was one of the things that really got me inspired about teaching and supporting, because there was a lot of teaching within that role. And that was one of the things that made me want to actually go into teaching. And then when that role finished, that's when I started thinking about working in education. And I think the role within education, again, it's a really important role, because we are developing and preparing new nurses for the workforce. And I know from my own point of view, last year when we were all out on a Thursday clapping for the NHS, I was clapping my student nurses who were out there on the front line, working within the pandemic, working with some seriously critically sick patients and supporting the workforce. And I, for one, was very, very proud of that, and very proud of our students who were out there in practice.
Thanks, Debbie. How about Steve? Okay to link with you, Steve? So what unexpected places might a career in nursing take you?
Yeah. Hold on. Yeah, I'm unmuted. Yeah. Well, it was interesting. I chose education as, I think, my final destination. But I had a reunion with my set, because we had a 30-year reunion, and they were doing absolutely everything. Some people had left nursing, but a lot had still stayed. So there were people who had chosen to work in prisons. There were people who tried to work in the private sector. People were doing all kinds of things. Some people working independently as nurse consultants, so that they were actually employed by themselves. I mean, I think things have changed. 30 years ago, I sort of walked in out of the School of Nursing, and the NHS opened its doors, and everybody went in. And I don't think that that's the case anymore. I've had students over 20 years now. I had one student join the Foreign Legion, another person joined the Israeli paratroopers and was a nurse in the Israeli paratroopers. Another one became a diving decompression nurse. I didn't know that you could be a diving decompression nurse, but you can be. And he was sending me sort of postcards and photographs of the Bahamas of where he was taking people diving. So, I mean, some people went into occupational health nursing. I had a student who was really, really interested in dementia and got a job in a dementia village in Holland. So my previous place of work, Birmingham City University, all the military nurses were trained there, and they weren't employed by the health service; they were employed by the military. So I mean, as far as I can see, the world's your oyster. I mean, you can apply it in any way that you want to apply it, and I mean, I would always urge people towards the health service, but that realistically, that's not what some students want. They've got a different view of what's going on, and so I think opportunities for nurses and where they choose to work once they're qualified has really opened up over the last 20 years or 30 years really, and you know, I think in general terms that's a good thing. And my job as a lecturer is certainly to facilitate students on where they choose to work for their careers. And there are some areas that I haven't known very much about, and I've had to go and get some advice for people. But I think that's a good thing, and I think it's varied. And if you've worked very hard to earn the qualification, then I think that you should be entitled to work where you want to work. So it's been a big change over the last 30 years. And I think the world's your oyster. You can do whatever you want to do.
Thanks so much, Stephen. I think that's yeah, it gives some clarity for people if they're sitting listening now, that actually the opportunities are kind of endless, and that, you know, we're learning as much as they are in terms of what those opportunities are going forward. If I could move to another question then, in terms of, well, what personal qualities do you need to pursue a career in nursing? I know probably the touch points that you all have with applicants, interviews that we undertake, and then finally our students. What are those personal qualities that you'll be looking out for those applicants to pursue a career in nursing? And if I could go to Debbie first, if that's okay.
Yeah, that's absolutely fine. So I think when I used to work in further education, teaching students, teaching the BTEC students, we used to, one of the qualities we said that they needed, because we would coach them to come for their interviews, in their nursing interviews, and we used to say good sense of humour and a thick skin was quite a good quality to have. And I think you need to have broad shoulders, and you need to be able to take lots of stuff on the chin. And have a good sense of humour. I think most people will find that nurses have got a fairly wicked sense of humour. But on top of that, they need the qualities like, you know, they need to be able to be compassionate and caring and demonstrate that within their interviews. They need to demonstrate that they understand what courage means, and that they can stand up and be courageous and advocate for their patients. So we do sort of look around the 6 C's of nursing to try and make sure that our candidates are, you know, possess those qualities. I do think that, you know, qualities that I see within my colleagues and colleagues that I've worked with are, you know, are that compassion, are that real desire to want to help people and to want to support people and to make a difference to people's lives. And I think as nurses, you know, you make very small but very important differences to people's lives as you go through your career, whether that be your patients, whether that be other colleagues, or whether that be the students that we're supporting throughout their journey into nursing.
Thanks, Debbie. Just as a further point to that then, Debbie, would you like to expand on what the 6 C's are, just for those listeners in case they don't know?
So, yeah, so the 6 C's are, you've put me under pressure now, Claire, because I need to make sure I remember them all. So communication,
We have a panel we can reach out to.
Communication, compassion, caring, competence, courage, and the other one... Commitment. Thanks, David. So those are the, so it's about being able to be a good communicator, an effective communicator, to be able to adapt your communication skills to, you know, to different people with different needs, to be committed to the job and the program. You know, it's not a 9 to 5 job. You know, you don't go home necessarily when your shift finishes. Sometimes you stay on. So demonstrating that compassion and that caring nature to your patients throughout the day, so that you are making a difference, and showing that you've got that courage to stand up and advocate for your patients if necessary, and to be, you know, to be out there, being their voice, really.
That's absolutely amazing. Thanks, Debbie. And I think that links back to one of those original questions in terms of you know, what were the things in those commonalities. So I think that kind of supports that, doesn't it? So David, if I could come to you, if you'd like to follow that beautiful app.
So I think I would say that the most attractive quality in a student nurse is being interested in what they're doing, being interested in the profession, being interested in the wider picture, being interested in each other and interested in developing themselves. I was talking to a group of apprentices this morning, and I said, you know, as you go through your career, the most important question you'll ask is why. Why is something good? Why is something not so good? Why is this happening? Why is that happening? And if you don't know the answers, finding out the answers, being inquisitive. And I think when certainly I have been admissions tutor and interviewing lots and lots and lots of student nurses, and those who actually take an interest and have shown to take an interest is a really, really appealing quality. And bear in mind that actually when people are applying to university to come and be a student nurse or any other professional, really, they're being interviewed by people who are of that profession and by nature of that interested themselves. So demonstrating an interest, I think, is certainly a characteristic that's going to help student nurses and to be fair, qualified nurses, registered nurses, anyone really, be interested in whatever's going on around them.
I think that's a great top tip. So thanks, David. So therefore, I think there's some elements here that we've spoken about in the last few questions. But how do you think that things have changed over the last 5 years? And how do you see that the careers in nursing developing over the 5 years coming? So if I could move to Steve first, if that's okay.
In terms of things changing, I don't think the fundamental core things about what we're looking for change that much. I mean, I really don't think they do. I mean, if you go back to the interviews, it's one of the favourite things that people tell me interviews, that nurses care for people. Well, what does that mean? You know, that's a very easy thing to say. Well, care can be an attitude, it can be functional capability, it can be emotional involvement. So I've asked that question from student nurses for 20 years. You know, what do you think nursing care actually is? So I think there's always going to be a concept of really, do you understand what you're getting yourselves into, and do you understand what you're trying to achieve for people who might be in absolutely desperate need? And I think that's a fundamental, and I think the concept of people being in desperate need, you know, small people, large people, you know, adults, children, either from a mental health perspective, a physical health perspective, a learning disability perspective, will never change because it's a human constant. In terms of the changes, so you can change programs and things can get restructured, but I haven't seen too many changes in values, which is good as far as I'm concerned. And in the next 5 years, you could have all kinds of changes structurally. I don't know what they're going to be, because I don't know. The pandemic might have an effect on something. We're short of nurses, so I don't know how that will affect things. But I don't anticipate the core recognition of professional values of being a nurse changing, because it's slow to change, and I think it should be, and I think it should be done with a lot of forethought. Because when push comes to shove in my job, it was 2 o'clock in the morning and somebody's lung had collapsed and they couldn't breathe. It was all on you. and you had somebody who understood that their life might be on the line, and 45 seconds, you know, the decisions you make in the next 45 seconds matter. And so I've always taken comfort from a consistent values approach, a values base that can be applied to any situation where I've worked, and you can go from ward to ward to ward and recognize it. I'm sure things will change in terms of process and structure and perhaps content, but that's fine. It's the values that I'm interested in, and as far as I'm concerned, that the values of my profession remain constant for the good.
Thanks, Steve. Teresa.
So I think that as a nurse, your values don't change, but actually the population's needs have changed in the past 5 years, and actually fundamentally those transferable skills can apply to any situation, but recognizing that their needs and their individual care needs. So we talk a lot about patient-centered care and making them the heart of what we deliver. And it is true, because I don't think what my children and young people needed 5 years ago is actually reflective of what they need today. Things have evolved and things change. And I think part of that is the degree in which we support with digital technologies, and how is that going to form part of our care planning for patients and our interaction and engagement. And the pandemic definitely has taught us how to use different approaches to engagement with our patients and making it more accessible. So I think in 5 years' time, again, I think that the opportunity for where nurses will have again tripled. I think we're taking a more autonomous approach to our care. We're taking more accountability of our patients, and our role is expanding. And we've seen that with the revision of our standards, that actually the future nurse standards is about looking at that prescriber ready, being ready to support from a broader approach for a wider demographic area. And I definitely see that in the nursing that I have been privy to, and I currently still work clinically, and I still see those enhancements and developments happening.
That's fantastic. Thanks, Teresa. That's yeah, it's really insightful again, isn't it, to kind of explore what COVID has influenced going forward. We all know it's had many changes that perhaps we won't go back to what was. So what are those next steps? And like you say, that population is constantly changing. I can see it in my own children as well, as to what was compared to, you know, I know it's more than 5 years ago, but from when I was a child. So it's always thinking about how does that profession and career alter over time, but while still acknowledging those foundations and core and values that Steve was talking about are still exactly the same. So thank you so much. If I could go to Debbie now, thinking about what would the next steps be for someone watching this event who might be considering nursing as a career, what would you recommend, Debbie? What are your top tips? What are the next steps?
My top tips, I think to research the profession, definitely. So to look at sort of information out there from the Nursing and Midwifery Council, to know what's expected of a nurse. And Teresa was just speaking about accountability and autonomy. Those things mean that we practice to support our patients and to support the people that we work with, to ensure that they're getting the best care and they're getting the best decision making, so support them with that. So I think it's important to for somebody coming into the profession to understand what it means to be an autonomous practitioner, and know what it means to be an accountable practitioner. We often talk about having some experience in care, to do some work in care. I'm not sure whether that's absolutely necessary. When I started nursing back in 1980, I didn't have any experience in care. And I think to come in from it, sometimes you're a blank canvas almost. And it makes it all the more exciting from the point of view of you as a student, going in and learning how to care for people, learning about all the different disease processes, conditions that we look at as nurses, and that you'll learn about as student nurses. I think sometimes a little bit of experience might be useful as well if you can working with people. So ensuring that you've got those sort of people skills that you can share and you can bring to the programme. So if you've worked in a shop, for example, you might have dealt with difficult customers, you might have had to adapt your communication skills. So I think sometimes out there, you know, some people skills, some knowledge of what it is to be a nurse and to care for people. And yeah, I think those are important.
Over to you, David, to follow that up. Is there anything else to add and complement in terms of Debbie's thoughts there?
Yeah, I think it's probably, if you are considering thinking about a career in nursing at this point, nursing is a really, really visible profession. People think they know what doctors and nurses do because they're there at the forefront of TV programs and they're being reported on and things like that. The NHS have got about 350 different careers. So my feeling would be explore a bit wider. Be interested not just in nursing necessarily, but you know, there might be other roles within the NHS that suit people's personalities a bit better. There's a really good NHS careers quiz. I think you Google NHS careers quiz and it comes up with a series of questions about you, your likes and dislikes, and it may offer some suggestions about things that you may not even have heard of in terms of job roles. So whilst I am absolutely an advocate for the nursing profession, I'm also aware that nursing is in a slightly privileged position in as much as people know what nurses do, or they think they know what nurses actually. Listen to this conversation, I'm not sure we know what nurses do, but there's there's huge variety, not just in nursing but also across the health service. So I would be interested in what else is going on as well.
I think that fits beautifully, thanks David, into the whole point of this week, is to explore some of those more unseen professions and job roles, whether out in the community, whether in acute, because nursing is so much out there in terms of the news and written about, and it has such a vast number in its population in the NHS as well, makes it, as you perceived, that you know what the role is all about. But could I reach out to Teresa then and see what your thoughts are from a different point of view for children's?
Of course. So I would say go for it. It is absolutely hands down the best decision I've ever made, to be a nurse and to be privileged to work with such a diverse population when they need it. And when they don't need it, it's even better because you're just an added bonus. And it really has given me masses of opportunity for personal and professional development and growth, of which I wouldn't have got in any other career. So I think if you are considering any healthcare future career, I think it's valuable and it's worthwhile, and most definitely is not just a financial gain from an individual perspective. It's helped me gain more than financial incentive, but about meeting some fantastic colleagues and peers, seeing the best in society and seeing society when it needs the most intervention has been very something I'm very lucky to have done and enjoy.
Thank you so much. So how about you then, Steve? What are your thoughts in terms of that question, in terms of the next step for someone watching this in terms of considering nursing as their career?
Be absolutely clear that's what you want to do and really go for it. If you're going to be a nurse, be a nurse. Don't dabble your toes in the pool. You know, you've got to decide to jump in and swim. And the character, certainly people ask me what makes success on the MSc. And it's very difficult to say because, like we said, people come from all kinds of backgrounds. You don't have to necessarily have a care experience per se. The characteristic of the people who are successful, their baseline is that they are resilient. They are just prepared to keep going. And it's a tough old job, nursing. It's multidimensional. You've got to think all the time. And you look after children and adults who, for various reasons, are in desperate need. And they're not equipped really to deal with the situation they're in and they need help. And that is hard work. And so you've got to be absolutely committed to doing what you want to do. And if you are, and you are resilient, you will find that you get up in the morning and you do a lot of good for people. And for me, the driving force of it is just the sheer humanity of the thing. You know, you've got to like people, because you're going to see people at their best and you're going to see people at their worst. So as long as you're resilient and you like people and you're prepared to do good for people, you can do it. But you've got to commit totally. That's the secret.
What wonderful final words there, Steve, in terms of that commitment, but jump right in. So all I can say is thank you so much, all of you, for being panellists for us, for David, Steve, Teresa and Debbie. We've reached the end, so thank you so much for answering all the questions that I'd got for you. It's really kind and really insightful. And thanks, David, for initiating all the original videos of the staff and colleagues at the University of Derby. Thank you very much.